going to be assessing your heart, circulation, and abdomen this time. So first I'm going to inspect, then palpate your chest. Good. Okay, there are no heaves or thrills, no shortness of breath, difficulty breathing, no accessory muscles are being used, normal respiratory rate and rhythm. So we're going to assess for tactile phragmitis now. So if you could actually face your back towards the camera. Perfect. Now as I touch you like this, say the words 99, okay?
Okay.
Starting now.
99, 99, 99, 99, 99.
Okay, sounds great. Then we'll assess for thoracic expansion. Okay, take a deep breath. Great, that's symmetrical and within normal limits. So as I have you back here, I'm going to auscultate your lungs. We'll auscultate the back, side, and then front. Each time I touch you with the stethoscope, take a deep breath. Great. Lung sounds are clear, equal bilaterally. There's no rhonchi, no wheezes, no crackles. So they're normal. Now we're going to percuss. Okay, there's no hyperresonance. It sounds a bit dull. So there are different times that we're going to do the bronchophy and egophy tests, as well as the whispered pectorilky. So those are going to be done in pulmonary specialties as well as in rural areas when like x-ray equipment isn't available. And it's done when fluid is suspected to be in the lungs. So just kind of an extra assessment that you can do. All right, go ahead and face the camera. We're gonna assess the 5 points of the cardiac assessment. So I will, as I auscultate, I will state what I'm assessing. So first I will auscultate with the bell. Aortic, pulmonic, Erb's point, tricuspid, mitral. Excellent. Normal rate and rhythm, noting S1 and S2. Flipping over to the diaphragm, aortic, pulmonic, Erb's point, tricuspid, mitral. Good. Again, normal rate and rhythm, no additional sounds. So we will actually have you lay down on this on your back. All right, so I'm going to inspect and palpate the precordium. Just breathe normally. Okay, there are no heaves or thrills. So when we assess the point of maximal impulse, we're going to go to the apical point, pulse point. Different auscultation positions or different positions that the patient is in while auscultating can help you hear different sounds. For example, in the left lateral position, it's bringing the apex of the heart closer to the chest wall. So that way you're able to hear sounds that would be absent or distant otherwise. In a sitting position, this allows you to hear sounds. The left lateral position allows you to hear extra heart sounds. And then the sitting position allows you to hear heart sounds that may be distant or absent in the supine position. Next, we'll discuss S1 and S2 sounds. So S1 is the lub in lub-dub. What's happening is the tricuspid and mitral valves are closing. The ventricles are ventricle contraction forces the blood through the pulmonary and aortic valves. So at this point, the heart is contracting, and this is called systole. S2 is the dub sound in lub-dub. So this is when the pulmonary and aortic valves are closing and the heart is relaxing. This at this point is called diastole. S3 is the rapid filling of the ventricles, aka ventricular gallop. This is normal to hear in children or young adults, but kind of goes away as we age. S4 is abnormal to hear. It means the blood is being forced by atrial contraction into a non-compliant ventricle. So S1 is usually heard as one sound, but there's a thing called splitting, and it happens when an asynchronous contraction of the left and right ventricles. And so it's to best hear that, you listen over the tricuspid area. Abnormal splitting can occur if there is a delayed or emptying of the right ventricle. The split will widen from a delay in the pulmonic closure. So next we'll discuss murmurs. Systolic murmurs are going to happen between S1 and S2. Diastolic murmurs, however, will happen between S2 and S1. Next part of this assessment is we'll assess the carotids. I'm going to inspect, palpate, and auscultate. Come over here to the right carotid. First, upon inspection, there's no obvious distension, no redness, temperature is good. So I'm going to palpate the right carotid. 2+, palpating the left carotid. 2+. I will auscultate right carotid. Good. It's not bounding, normal rate and rhythm. Same on this side, not bounding, normal rate and rhythm. Okay, next we'll examine the peripheral pulses. So let's examine your brachial pulses, so both arms at your side. I'm going to feel them at the same time. Okay, 1+, equal bilaterally. Let's feel your radial pulses. 2+, equal bilaterally. Feel your dorsalis or pedal pulses. 2 plus, equal bilaterally. Then in your inside of your knees, popliteal. 1 plus, equal bilaterally. And then the posterior tibia, this inner ankle here. And it is 2 plus, equal bilaterally. Okay, next part of this assessment is the abdomen. So first, do you mind if I lift your shirt? Okay, excellent. First, I will inspect. Upon inspection, abdomen is symmetrical. There's no bloating, no ascites. Umbilicus is midline. Okay, so I will now auscultate in all 4 quadrants. Listening for normal bowel sounds. We don't want anything, no hyperactive or no hypoactive. So here's the right upper quadrant. Normal. Right lower quadrant. Left upper. Left lower. Excellent. Good bowel sounds. Nice and normal. All right, so next I'm going to palpate lightly in each 4 quadrants. Tell me when I do this if there's any pain or tenderness, okay?
Nope.
Good. All right, next we're going to percuss the liver. Within normal limits, a little bit dull. Now we're going to percuss the spleen. Take a deep breath in. Okay, it's normal, tympanic noises. All right, go ahead and breathe normal. Excellent. Now I will palpate the aortic pulsation. So I'm just going to find your umbilicus, go about 2 inches above that. Then we're going to palpate how wide we feel the aortic pulse. All right, let's say about 2.5 inches. Okay, next I'm going to palpate 4 quadrants deeply. So same as before, just tell me if there's any pain or tenderness.
Nope.
Excellent. Okay. So now let's have you lay on your stomach. All right, I'm going to assess for costovertebral angle tenderness or CVA tenderness, and then I will palpate the right and left kidney. Any tenderness there?
Nope.
Okay, right kidney. Okay, or dullness, left or right kidney over here. Nice and dull. Okay, it's all within normal limits. Thank you very much.